clear-cut, significant, positive effect in diminishing the time to recovery. And if you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. Although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus.
Dr. Anthony Fauci sounding very optimistic about an experimental drug called remdesivir that could block the coronavirus. The results haven't been published yet in medical journals, but Dr. Fauci says the data is so promising that there is, quote, an ethical obligation to immediately let the placebo group know so they can have access. Joining us now, emergency physician and public health professor at George Washington University, Dr. Leana Wen. She previously served as Baltimore's health commissioner. Her latest opinion piece in the Washington Post imagines what Trump's coronavirus briefings would look like if they focused on the facts. And we'll get to that in just a moment, Leana. But first, remdesivir. How hopeful is the news on this drug?
Look, we should be cautiously optimistic, Mika. The great thing about the study is that this is the first of its kind. This is the first randomized controlled trial that compares placebo to a treatment. And up until now, we haven't had any treatment that's shown this type of promise. And so having something that is a potential proof of concept is really important, because we can now build upon what we know about this drug's mechanism of action and have some type of hope for treating individuals who are really ill. I think we should still be cautious, though, because this is not a cure. This is certainly not a panacea. It's not meant to prevent COVID-19. And there's still a lot of research that needs to be done about who will benefit from this medication and what the treatment really is for. So cautiously optimistic.
Cautiously optimistic, and if everything were to go perfectly. I know that's saying a lot, but between now and the time this drug is being used to treat it, how long would that be if all results came out perfectly well?
Well, it looks like the Food and Drug Administration will be approving this medication for emergency use, which I think will be important because, again, we don't have anything else on the market. And this is a medication that's, at least according to this most recent study, looks like it's most effective for hospitalized patients with severe COVID-19 who likely don't have any other options. And if it decreases their length of stay in the hospital, which means that they can recover and actually leave the hospital faster, then that is a big step in the right direction. But again, it may only be beneficial for these patients. It may not be beneficial for patients with less severe illness. And so we need to study this a lot more, but it's a very good first step.
Hey, Dr. Wen, it's Willie Geist. Good to see you again this morning. I want to ask you about testing, something you've emphasized, something every public health official has emphasized as key to getting our arms around this pandemic. You have a little bit of a nuanced take, which I think is interesting, and Dr. Fauci has reflected this too, which is that the testing problem, it may not be as monumental as some are making it. In other words, you don't necessarily need to test 330 million Americans, that it can actually be done, that the right people who need to be tested can be tested. Could you flesh that out a little bit and explain?
It's a great question, Willie, and I think the key about testing is that we need to be doing much more testing than we currently have the ability to, and much more than the White House is outlining in their plan. So we have to be testing every individual who has symptoms to know whether their symptoms are actually COVID-19 or not. I think that should be clear. Another is we need to be testing individuals who are in the high-risk categories, but people who work in healthcare professions, people who live in nursing homes, etc. And then we also have to be doing surveillance testing, because we know that this is a disease that is transmitted by asymptomatic people. So we have to test enough of the population of individuals who don't have symptoms to understand that we are getting a grasp of what is the true spread in our community. But all that said, testing alone is not sufficient. It's necessary, but not sufficient, because you also have to be then following up the testing with contact tracing and identifying each of these individuals who test positive positive and who their contacts are that they could be exposing. So we do need to have available potentially up to millions of tests every day so that we can get a grasp of what's happening in our communities and then give people the reassurance that they're okay to go back to work or go back to school.
Mike Barnicle.
Dr. Wen, I'd like to follow up on something you just referenced, contact tracing. How expensive is it to do? How difficult is it to do? And how beneficial would it be? Like, based upon your experience as health commissioner in Baltimore, could you talk about the degree of difficulty and the benefits of it?
So contact tracing is the bread and butter of public health. It's what local and state public health officials do every single day for illnesses. I mean, in Baltimore, for example, we traced outbreaks of tuberculosis and Legionnaire's disease and measles and all these other infectious illnesses. That's just what we do. So we know how to do this. We have people trained to do it. It's something that is labor intensive and time intensive because you have to be calling each person who tests positive, gain their trust, which is really important, especially in communities like Baltimore and around the country that have a long history of distrust between the government and medical institutions and the people. And then you have to identify each person that they came into contact with, which could be hundreds of individuals if somebody got on a public bus or was in some other public space, and then call each of those people. So it's something that you can easily train people to do, but it does take time and it does take a lot of energy. And so this is something that is absolutely essential in boxing in COVID-19 as it is for other illnesses, other infectious illnesses too. Because ideally you get to the point that you can find each person who tests positive, identify all of their contacts, and then you don't need a societal lockdown. You can focus on this individual level strategy.
Lena, I want to talk about your piece that looks at, what would it look like if the scientists actually led the way on these briefings? So what would it look like? And would we be in a better place with this virus?
Mika, we would absolutely be in a better place if every day we received evidence-based, science-based information that's focused on the facts. Look, I've been watching these briefings basically every time that they've been held, and I've watched how there is misleading information, inaccurate information that's put out, that the scientists then have to twist themselves in knots to try to explain while not offending the president. It looked like they're undermining the president, and then the entire news cycle is dominated by that distraction. Instead, imagine what the briefings would look like if every day the scientists from the CDC began with the numbers. Where is the outbreak happening? Where are the epicenters going to be, the hotspots going to be? What are we learning about different interventions happening around the country? And then there could be an update about the latest science and research, because there are new studies coming out about COVID-19 every day. There are trials, for example, about remdesivir that we talked about. But also there's new research showing last week even that young people, previously healthy young people, are getting strokes because this is a virus that doesn't just affect the respiratory system, it's affecting the nervous system and the kidneys. People should understand about that. And imagine too, if the best scientists and doctors in the world who are working for the US federal government, if these individuals are then saying, and here's how you can protect yourself, here's what businesses can be doing to protect employees, if you have to go out, here's how you can stay safe. I mean, the CDC has all these guidelines. That's what they do every day. And I hope that we can begin to move towards that type of briefing that's based on science and evidence that actually helps people understand how we can stay safe in this time of a pandemic.
All right, Dr. Lena Wen, thank you very much. Always great to have you on. We'll see you again soon. Up next, breaking news on the economic crisis with the first of two key reports over the next 2 days, the jobs report tomorrow. But first, the jobless claims. Keep it right here on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.